Well, good morning. It's Jason Renault with the Alternative Mobile Services Association. And today, AMSA Talks is going to talk with Jane Mogavero of the Patrick Lee Foundation in Erie County, New York. Welcome, Jane.
Hi, thanks for having me, Jason. I'm really looking forward to speaking with you.
Well, let's start out today. We haven't met you before, and we'd like to know more about you. Tell us about Jane Mogavero. Tell us about you.
Yeah, so I am here in Buffalo, as you said, in Erie County, New York. I have been the executive director of the Patrick Lee Foundation for 10 years. I came into this position having a fundraising background, and I did work at our community foundation of Greater Buffalo for a couple years. It's been a wonderful opportunity. I'm a lawyer by training,
Wow.
so left that career for one that I find very meaningful in helping the Lee Foundation achieve their mission.
Well,
Um,
good for you. Tell me about Patrick Lee and Patrick Lee Foundation. First, tell me about the foundation.
yeah, so the Patrick Lee Foundation is a private foundation. We have about 50 million in assets, and we focus in two major areas, post-secondary education and mental health. In post-secondary education, it really is a true scholarship sort of program that we've set up. We support students pursuing STEM degrees, their junior and senior year of college, and then if they are at a community college in the second year of schooling. Um, I will talk about Patrick in a moment, but he is an engineer, so he feels very strongly about that field and the value that they bring. And he himself received a scholarship to go to college. So it's a very pay it forward side of our work and one that brings a lot of youth and enjoyment for us getting to meet these scholars. We actually support about 170 scholars a year across New York State and into Boston, Massachusetts.
And tell me
And
about the
then,
mental health side.
yeah, the mental health side is certainly also very personal to Patrick and his family. So Patrick's older son, also named Pat, was diagnosed with schizophrenia when he was in his early 20s. He had enlisted in the Navy, and they were the ones that actually first diagnosed him. So the family understands the challenges of the system of care, the difficulties of finding the right services, and just what happens to families and individuals when they're working through diagnoses of this type.
Well, tell me, you came to my attention because you wrote a commentary piece for the Times Union newspaper about some shortcomings in the mental health system in your community. Could you tell us a little bit how that came to be?
Yeah, so that was co-authored with Dr. Mike Hogan, who's the former mental health commissioner of New York State. So I want to give him his due credit as well. And I've been working with Mike Hogan for about 2 years. I knew him through other work that we had done, and he came in to sort of help Erie County do at first just an initial assessment of our crisis response system. That work has really deepened and expanded, and we now have additional experts helping us. But it really began with just what is the current lay of the land here, and
Mhm.
what we believe is that through our work for the past 2 years, we've really developed a unique model here in Erie County of how stakeholders across systems can come together to achieve shared mission. And I do believe it's unique. We have a lot of different components of the collaborative that I can talk about in a bit, but we really wanted people to know that we think, we're onto something here, and this is a national issue, right? It's not unique to Erie County. We often rely on law enforcement and other, service to handle these situations when really, mental health crisis deserves a mental health response.
And focusing on crisis versus other parts of the mental health system that may also be equally bollocks, but you have these relationships now with all of these governmental entities and nonprofit organizations to have this really wide-ranging conversation.
Yeah, and I think this is the unique part of philanthropy, right? I'm fortunate to be invited to sit on several committees that the county runs, and even a state one for a while. And so I'm in these rooms listening to these incredibly dedicated service providers and clinicians, and you know I wish it had hit me earlier, the need for this sort of support from philanthropy, but I was part of a crisis care continuum meeting that was started by Erie County, the mental health commissioner at the time. And, I was a good listener. I'm, attending monthly meetings and hearing the frustrations of the partners at the table who were at the time mostly mental health providers.
Hmm.
And I began to realize that a lot of them were our current grantees, but we were funding them for all different types of things.
Hmm.
So Best Self was at the table, and we were at the time supporting internships for one of their clinics, and then Crisis Services was there. And, I had not really looked at our grantees as what common issue runs through all of them. And being on this committee, I realized the challenges of crisis response. So from there, it sort of got my board thinking and me thinking like, we're still supporting the same partners we've had, but now we're really coalescing around this shared concern of how the system is falling short. And so that really began, honestly, in 2023, towards the end of 2023.
Oh, so this has been going on
And
for quite a long time.
yeah, and I think that's true in a lot of communities that people know that this is an issue. This is a tragic at times outcomes. And, it's just one of our partners said, if we could have done it on our own, we would have, right? Everyone wants to fix it. It's
Hmm.
not
Hmm.
anyone's resistant to that idea. What we quickly realized is that mental health was trying to solve it sort of alone. And this is a cross systems challenge. So, as well intentioned as we are, we cannot be doing it without our partners across government and in other
So
sectors.
you had a neutral perspective here, engaged but neutral. So you were able to bring some others that hadn't been in the room.
And I think, the providers at the table would have said, of course, we want to have a
Right.
relationship, but they just didn't maybe know how to bring everyone to the table. And I think philanthropy is really good at convening, right? And
Yeah.
that's a role that we should embrace and lean into, that we are neutral. And, we're solution focused and, we don't have an agenda of our own, right? We're just trying to sort of help the group come together. And so that was really the first step. And I think, that's not to say there weren't pilot projects that happened. There
Hmm.
was an ambulance diversion project with EMS, and a provider, and there was a pilot that had started with 911 and crisis services for 988,
Hmm.
transfers. And so, but they were all very isolated. So they were happening with finite, investment in time, and then they would sort of end, and then the next sort of pilot of interest would begin. But there wasn't that sort of continued, sustained focus of the partners.
So this became the Crisis to Care Collaborative, this
Correct.
greater group.
Yeah. One of the things that became evident too was that we needed the buy-in. We obviously knew the first feet on the ground. They knew the need, right? The people that were doing the direct work, but we really needed to make sure the leadership of these different sectors were also as committed to finding the solution and working together. And again, I think that's where philanthropy was able to help. So we set out to talk to the county, talk to the city, talk to the CEO of our safety net hospital. And, through a series of conversations, they all sort of came together and agreed that they would prioritize this among their sectors, that they would make data available, which is a huge accomplishment, I think, of the collaborative, that we have 10 agencies, both government and nonprofits, sharing data so that we can understand the system and make informed decisions. And it's bipartisan, the leadership team that we put together, and so it just shows the reach of this issue and the desire of everyone to move it forward. We also really wanted for the foundation that these leaders were accountable to the community, right? So this
Mm.
wasn't intended to be just some nice idea of philanthropy. We wanted them to really own this and be public facing and let's be honest about where the system is falling short and identify opportunities. But the community engagement and public accountability piece, I think, is also what makes this a very unique endeavor.
And that holds the city and county maybe a little bit less, gets a less squabbling between the two.
we were fortunate, and I realize this is not true in all communities,
No.
that there was a mutual respect from the city and county.
Wow.
They don't always get along, and come a bad snowstorm, you will not see them agreeing on how to handle it. But around this issue, I think they understand they can't solve it alone, right? That this is truly something that requires everyone at the table. The sheriff, the mayor, the deputy county executive, the CEO of our hospital ECMC, we all need to be there. No one group was going to fix it. And I think that's probably from years of trying to do it that
Yeah.
way, that there's a recognition that we all need to be together.
Or years of waiting for someone else to fix it.
Hmm. Yeah. And I think we were really fortunate that this was an issue that, and I will say Buffalo had an unusual transition of mayors. So since this initiative started, we are now on our third mayor, and it's only been about a year and a half. So
Oh,
um, it's what that tells me is, and each mayor has been equally open to being a partner.
okay.
And it's so it doesn't live with a person, right? Like this is a bigger issue, and the systems need to be buying into it, not just individuals.
Well, that may be a unique political experience. Yeah. Very
It
different.
has been an unexpected one,
Yeah.
but yeah, we've
Yeah.
we've navigated it, I think, pretty well.
That's an idea. Maybe we shouldn't have mayors for 4 years, maybe just 6 months.
I don't know. I wouldn't suggest that. I think
No.
think we managed it, but I would not advise anyone to follow that quick of a transition through this. But we are fortunate that even the new mayor who just came into office in January, his staff is was very receptive when we were reaching out to them, and we're confident that he'll be a good partner.
Well, so as this crisis um, to care collaborative comes into being, it looks at the mental health system of Erie County. What does it see? What's the condition right now? What's the status of mental health in Erie County?
Yeah, so probably not all that different from other communities. We have an over-reliance of calls coming into 911, a police response being sent out, and transport to a hospital ED or the holding center. For us, we found more transfers to the emergency department. So I know in some communities that might look a little
Mhm.
different, but um, it's sort of just a funnel. They come in to 911 and they just go straight down. And what's puzzling about that in some ways is Erie County does have a lot of resources. We are a community that has diversion programs. We have behavioral health teams, maybe not at the capacity we would like, but they exist. We have crisis services, but the vast majority we're going through that sort of fast track between 911 law enforcement and the hospital. And, using Buffalo as an example, I think we found that 27 times a day, Buffalo police or EMS were responding to a mental health emergency, which is
It's
it's
a
a
bunch.
significant issue happening here, right? And so, how do we do better about that? And then, we really are approaching it sort of, I just named those three components, but, someone to call, someone to respond, and somewhere, appropriate and safe to go. And again, I think that is unique about the collaborative as well, because a lot of communities maybe zero in on one piece of that. And I think we've really intentionally recognized that from the call to, the final place that the person might be brought, all those components work together. And we're here to talk about mobile response, was a critical piece of it. But if you're not getting the call coding right, you're not sending out the team anyway. So these things really do interconnect in a very clear way. And I think I'm really appreciative of our stakeholders and collaborative members for recognizing all three of those require our scrutiny and attention.
Yeah, the crisis has points of complication all the way along from the very mo first moment to the very
Yeah,
last. A moment ago, you mentioned crisis services, and I think we need to tell our listeners that that's a capital C, capital S crisis services. That's an
correct.
organization.
Yes, and I thank you for reminding me of that. Yep, they are a nonprofit, been here in Erie County for decades. They are really the sole mobile response team with clinicians that we have here in Erie County, and they also work beyond Erie County, but they would be the primary provider here in Erie County. They also manage the crisis hotline, a local crisis hotline, the
Ah,
988. So they really provide, when I look at our working groups of call, respond, go, I think they're on all three of them, right? Like, and so that is unique, I think, to our county. And again, we have behavioral health teams, but crisis services would be the primary mobile response.
oh, that's great. So that's good to hear that there's a team is up and running. This report came out just very recently in December. Is that correct?
Correct. Yes.
50 some page report. It's available online. We'll have that linked below in the narrative box and on the newsletter. Tell us a bit about the writing of this report. These are not easy to create.
No, and I want to just recognize the 10 agencies that did contribute data. It's we were calling it vulnerable leadership. It's acknowledging where you don't love the numbers that we're putting out there, right? I mean, we all want to
Okay.
be better than what they are. And I think it's hard for nonprofits to sometimes, especially come to a funder and show where the challenges are. We often want to support the, rising star, and what we've said to our partners at the table is this is a process problem, not a people or nonprofit problem. Like this is a system that we've created through decades of decision making, and so we don't want to finger or single out or finger point any one group. So one, I really appreciate everyone's transparency in sharing this data. Um, you know, I think that's unique in itself. And so we have these 10 agencies, crisis services among them, 911. We're working with 3 police departments here in Erie County to start. Buffalo as the largest urban center, and where about half the 911 calls come from. And then 2 suburban sites, Cheektowaga, which borders the city, and then
Hmm.
West Seneca, which is a more traditional sort of suburban, smaller police department. So they provided data. I mean, it's been really informative to see, how the volume of calls come in, how they're coded, who's deployed. The challenge with crisis services right now is workforce. And so this is
Yeah.
true for all mental health providers. And I would say law enforcement is having similar 911, similar vacancies and recruitment challenges. So some of what's happening here is a lack of staffing and workforce strength. So we've realized about half of crisis services mobile responses weren't being completed. And that's for a variety of reasons. One, the person might not be there anymore, right? So by the time crisis services gets there, the person may have moved, it may have escalated in a situation, and now police, are there instead. But really, it's the time delay in deploying the team because they are not fully staffed in the way that we need for the community
Mhm.
in terms of just manpower. It does take them a long time to get across the county and respond to things. And so, recognizing that's not because crisis service isn't great at what they do, it's just they don't have enough of them, doing that. So actually, as an example, the Lee Foundation just provided a grant to help them double the number of mobile crisis teams over the next 18 months.
Oh,
So
great. That's
we're
great to
using
hear.
it as a foundation as a way to identify real need, and philanthropy can't solve all the issues, but in something like that we can. So
Well, that's a
we
press release all of its own.
yeah, exactly.
That's great.
Thank you. Mhm.
So you have this report now, and you have
Mhm.
this consensus between these organizations' operations. That's great. Tell me about the findings.
Yeah, so starting with the call, we identified 710,000 calls that come into 911 annually in Erie County. Um, for those that know PSAP, so public safety answering points, Erie County has over 20, which is a lot for our county size.
Mm,
I'm learning.
mhm,
So that's why we started with just 3 uh, Buffalo or police departments, because we just couldn't possibly take on 20 and try and figure out, the nature of how they're call coding and things like that. It is our goal, but we had to start somewhere. So of those calls, about half do come from Buffalo, and we were able to determine about 3% are coded as mental health. When you talk to someone in law enforcement, they would not think that was a good number
Yeah.
for reflective of what they are seeing in their going out on these calls. And so it sort of starts there, like, well, why is that? And there's a variety of reasons. Some we have an older call system, and so coding only allows you to put in one code. And if you have a weapon and a mental health challenge, they're going to code it as a weapon, right? Like, so how do we improve that? We're fortunate that the county is implementing a new computer assisted dispatch system this year, which would allow for greater input of information and coding. So that's a real exciting opportunity that was kind of coming to fruition anyway, but now we're going to be more strategic about having similar call codes across the PSAPs, and how do we get the system, even if we have 20, how do we get them to sort of be a little more in line? But we do think that will increase the call coding. And we're also looking to provide training opportunities to those 911 call takers and dispatchers so that they, have a better awareness of what might be a mental health call when it comes in.
Yeah, it's
And so
alarming to me how little training dispatch and call takers get in
it
this area.
really should be a professional level job, right? I mean, the stress that they almost go under, sitting there, answering these calls and triaging, and it's an incredibly skilled position, but I don't think we pay it or recognize it as such. And so recruiting, people that are a really good fit for that position is certainly, something that we're talking about.
And the psychological experience of taking a call that might be a very disorganized person, where you don't
Mhm.
really understand what's going on with them, it's really discouraging, very ambiguous. What happens?
Mhm.
Very gray, very hard to feel confident about.
Yeah, and we've seen some other communities that embed clinicians into that call taker
Hmm.
space to provide assistance. One of the things that we've learned through this work, and I, would not be surprising anyone, is it is a burn and toll out on these first responders, right? And so how do we provide them their own mental health supports
Yeah.
to be successful, and then mental health training to, support their job. So, um, the what we ask of our first responders, both mental health side and law enforcement and 911, is a lot. And, we need to take care of each other as we go through this work.
Tell me about your findings in relation to mobile crisis.
Yeah, so I touched on it a little bit. So about half the time, and I'll double check that number so that crisis services doesn't, so 55% of mobile crisis teams are unable to complete their visit. So it's
That's
actually a little
high,
more than half the time.
a little high.
And, we touched on some of those reasons why, right? The time it takes for the mobile crisis team to be dispatched. Sometimes the person that they're going to find is not there,
Hmm.
or the situation has changed in one way or another. So it's not, again, that they're not very skilled at what they do. And we have found when they are able to connect, there are better outcomes for the individuals. But it's just that challenge of, they don't have lights and sirens. Our county is a little spread out, so they're not just focused on Buffalo. They're responding across the county, and they genuinely did not have enough teams on staff
Yeah.
to meet that need. So, and then the reliance on law enforcement was the result of that is we rely on law enforcement to be the first one out there. Um, 911 will tell you sometimes that is the caller's choice, right? So they will say, we can connect you with 988, and they're like, I need someone now, right? And so some of this is understanding
Sure.
the timeliness of responses and people's expectations, and law enforcement will always get there the fastest. So I do think it's natural to see how they're utilized the most at times, because when a family or person's going through that, the thought of waiting 30 minutes, 40 minutes doesn't seem realistic.
That's very understandable.
But we found that we're not using our behavioral health teams maybe as effectively as we could. So some of that, again, is they are also understaffed. But uh, before COVID, they were doing more direct dispatch, and then variety of changes. Right now, they're not directly dispatched out of Buffalo. So they can jump a call if they hear it and they're available, they'll
Oh,
go.
okay.
But it's not a direct dispatch. And so that's something we're going to talk to the new mayor about. And I think there is an interest from the behavioral health team there to go back to those, being on the front end of those calls because they're the best trained, to be out there on the police side.
Mhm.
But that was something we didn't realize until we sort of were getting into the conversations.
The report also came out with a set of opportunities
Mhm.
that Erie County Buffalo could look at.
Yeah. So as I mentioned, that new CAD system is going to be
Mm.
really great for the call taking side of things. It just has a lot more capacity, a lot more bells and whistles, if you will, but it really is going to allow us to have a better sense as calls come in, how to multi-code a situation. We also are working with law enforcement to have police officers, once they are on scene, to update the notes or code to reflect, hey, this didn't get coded as mental health,
Okay.
but it was. So we're kind of approaching that from both sides, just so we can better understand the true volume of need. I mean, I don't think any of us believe it's 3%. So we're
No.
trying to really understand um, what is the need in the community, and then how do we staff to meet that need, right? So
Mhm.
that's part of it. So that's on the call side. Like I said, also some additional training and opportunities for call takers and dispatchers. For the go side, response side, I did just mention that grant to crisis services to increase their capacity. We're fortunate that several other police departments in Erie County are starting behavioral health teams, so being supportive of those efforts. And then working with Buffalo to, again, start doing more direct dispatch, help them potentially build out the coverage for their behavioral health teams. They just don't have the bandwidth to really respond in time right now to every mental health call that's coming. So how do we sort of pilot an expansion of that? And then on where to go, we are really fortunate in Erie County that the state has granted Best Self Behavioral Health, one of our mental health providers,
Mm.
the license for an intensive crisis stabilization center. It is actually supposed to open, I believe, next week. So again, it seems like with this collaborative, like there's good work happening. There's fortuitous things that were already in the pipeline that we can leverage and lean into. And so um, it feels like the momentum is really with us as we go forward.
Does your collaboration intend to continue to meet and do things?
Oh yeah. Oh, we're just getting started. I always say, this is, I'm a runner, so I would say a marathon, not a sprint. We view this as a long-term commitment, both by the foundation, but also all the partners at the table. I mean, these are 700,000 calls a year. I mean, this is a complicated, big system. It's not going to see light switch type changes. So we really need to be invested long term. But the three working groups right now that we have the data and the baseline, they are meeting to develop recommendations and targets for the coming year. So how much are we going to increase the call coding by? And each of those working groups is putting together what their goals are, and then what resources would be needed to achieve some of those goals. So that's a big piece of it. We also, I have not mentioned, but we are very engaged with the community. So we have a specific group that we call the advocacy working group, where we have a
Ah,
lot of our friends from NAMI, mental health advocates, the peer-run organizations who maybe aren't direct providers of crisis response services, but certainly are so critical to be at the table and have their voice heard. So we've hosted 2 listening sessions this past year, and then a focus group for people with lived experience. And I anticipate that we will continue that engagement going forward. So we just released the report. We're excited to now use this information to make good decisions for how to take our first step forward in improvement. But yeah, this is, I think we all see a long-term horizon in our work here. It's not going to be done in a year.
oh, that sounds great. Thank you, Jane. Thank you for telling us what's
Yeah,
going on.
Jason, thank you so much. It was great to connect. I appreciate the time.